Surgical care has been an essential component of healthcare worldwide for over a century. As the incidences of traumatic injury, cancers, and cardiovascular disease continue to rise, the impact of surgical intervention on public health systems will continue to grow. Over the past 2 decades, patient safety has been brought to the forefront of practice-based research. Healthcare leaders and researchers have strived to identify areas in which patient safety might be improved. In many cases, they have turned to checklists as solution to the identified safety problems. A surgical safety checklist is a patient safety communication tool that is used by a team of operating room professionals, anesthesiologists, surgeons, nurses, and others to discuss important details about each surgical case. There are 3 steps over the surgical safety checklist: sign in, time out, and sign out. Sign in to be read out loud before inductions of anesthesia. Has the patient confirmed his or her identify, site, procedure, and consent? Is the surgical site marked? Is the patient use implant? Is the anesthesia machines and medication check complete? Does the patient have known allergy, difficult airway or aspiration risk, risk of more than 500 ml blood loss, or 7 ml per kilograms in children? Timeout to be read out loud before skin incisions. Confirmed all team members introduce themselves by name and role. Confirmed the patient's name, the procedures, site, and positions planned. Has the antibiotic prophylaxis applicable within the last 60 minutes? Anticipates critical events for surgeons. Are there any critical procedures or unexpected steps you want the team to know about? How long the operation will begin? How much blood loss is anticipated? For anesthetist, are there any patient-specific concerns? And for scrub nurse, has the sterility of the instrumentations been confirmed? Are there any equipment issues or concern? Is the procedures need radiology instrumentations? Sign out to be read out loud before patient leaves operating rooms. Nurse verbally confirms the name of procedures, issues implant, and does the implant have a problem? Whether there are any equipment problems to be addressed. Completion of instruments, gauze, and needle before and after the procedures. Specimen labeling. To scrub nurse, anesthetist, and surgeons, what are the key concerns for recovery and management of these patients? Fundamentally, in surgery procedures, the surgical safety checklist has been widely celebrated as a success story, calming statistically significant decreases in peri-operative mortality and morbidity on a global scale.